Okay, the next thing that we're going to cover is the revised trauma scale. And the revised trauma scale uses your calculated GCS in it. So when you're assessing a patient, you want to make sure that you get your Glasgow Coma Scale first. So in our revised trauma scale, our patient's GCS is going to change the points that they get. So if a patient has a GCS of 13 to 15, if their systolic blood pressure is greater than 89, and if their respiratory rate is 10 to 29 breaths per minute. This is for an adult, so don't really pay attention to this for children, because there should at some point be a different scale for children, because this is just for adults. So when you're assessing your patient and you check their Glasgow Coma Scale, if it's 13 to 15, they get 4 points. Okay? If their respirations are 10 to 29, they get 4 points. If their systolic blood pressure is greater than 89, they get 4 points. Okay? The revised revised trauma score is mostly used for patients who, are suffering from severe head injury. And the reason that we use this is a patient's chances of survival are higher the higher they score on this revised trauma score. So the top line in this, if your patient falls into this top line, they get 4 points. So if they get 4 points for their Glasgow Coma Scale, they get 4 points for their blood pressure, and they get 4 points for their respirations, the maximum number of points that your patient can get is 12. Okay, does that make sense? Now, if their GCS is 9 to 12, if their systolic blood pressure is 76 to 89, and if their respiratory rate is greater than 29 breaths per minute, then they get a score of 3, and they can get a score of 3 in each of these categories. So if they have a GCS of 13, their blood pressure is 80, their systolic blood pressure is 80, and their respiratory rate is 20, they're going to have 4, 3, 4. So they would have a revised trauma score of 11. If their GCS is 6 to 8, their systolic pressure is 50 to 75, and if their respiratory rate is 6 to 9, each of those categories would give them 2 points. If their GCS is 4 to 5, if their blood pressure is 1 to 49, and if their respiratory rate is 1 to 5 breaths per minute, they can get 1 point in each of those categories. All right. Then the bottom of the revised trauma score is if they have a GCS of 3, which remember that a rock can have a GCS of 3, we just talked about that. Their systolic blood pressure is 0, they have no respirations, they get a score of 0. The likelihood of survival is not very high. Now, it's possible for you to have a GCS of 6 to 8, let's call it an 8. You have a patient so that's 2, right? That's 2 points in that line. Then you have a patient who has a systolic blood pressure of 80, so they get 3 points there. Their respiratory rate is 6. So they get 2, 3, that's 5, 2 is 7. So that's how the revised trauma score is added up. I hope that makes sense. No one's here to ask questions, which is my own fault, and that's okay.